Hi guys, welcome back. In this video, we shall be talking about gas under diaphragm. That is a medical emergency, rather I'll say it's a surgical emergency. So, what is the gas under diaphragm? What does it mean? So, before we start, I'll just give you this is the X-ray, that is the meaning of gas under diaphragm. But before that, you have to understand the basic understanding of the chest X-ray. So whenever we are doing the chest X-ray, you have to see the airway. Airway is the trachea. This is the trachea. Remember, whatever is air will appear as black in X-ray, and whatever the bone, it will appear as white, and fluids will appear as white. Okay, air will appear as black. So this is black. It is the trachea. Trachea contains air, and you have to see these are the spinous process. You will be able to see actually 4 spinous process. If you're able to see more than that, this means it has been more overexposed. That means more amount of X-ray has been given. If you are seeing less amount of spinous process, this means it is underexposed. So you have to make sure that the exposure is adequate. Along with this, you have to see this is the clavicle. This is the end part. This is the end part. Right? You have to see from the distance from the end part of the clavicle to the spinous process. Same goes with this. This means that the patient is standing still. If the patient is in this manner or in this manner, you will be having problems, you will be having fault interpretations. Along with this, whenever you see the X-ray, you have to make sure that you're always comparing the X-ray of one side to the another, and you're going to divide into 3 parts, 3 zones, 1 zone, 2 and 3. Right, you compare this, the color of how much black it is, you have to compare with the another side. That is important, right? So this is the entire thing is the this entire thing is the lungs. This is the lungs. These are the your ribs. These are your ribs, right? Along with this, this is your clavicle. This white thing is actually your heart, and which is the diaphragm? This black part and the white junction, right? This is your diaphragm. This is your diaphragm. So this is what you have to understand about the X-ray, right? So whenever you see, you have to make sure the trachea is centered. Now the trachea can be divided into left or right side, that is away or towards the disease side. This trachea can be deviated towards one side, or can be pulled in one side. Now why will it be deviated away? Basic concept, it will be deviated away because something has to push. Maybe a mass, maybe a tumor, maybe something is pushing, or something has to pull. Why would it pull? Due to a negative pressure, negative suction, that is your fibrosis, or you have collapsed lung. That is what you have to see. That is the reason trachea will be shifted, right? Along with this, you have to see the bone. You have to see, is there any discontinuity of the bone? Discontinuity of bone means, it will mean that you're having a fracture, right? After this, you have to see the angles. This is known as costophrenic, cardiophrenic, costophrenic. Remember, this angle has to be sharp as like the beak of the birds. The beaks of the bird, it has to be as sharp as that. Now remember, whenever we're taking this X-ray, we're standing up. Anytime you have fluid in the lungs, due to gravity, this fluid will get accumulated. Remember, fluid will appear as white. So this angle will be obliterated. That means even with small amount of fluid, the first fluid will be filled in the angles, right? That is the reason we have to make sure that the angles are sharp, right? After this is done, you have to see the heart. What is the size of the heart? Now whenever we talk about size of the heart, you have to draw a line from the maximum heart shadow to the maximum transverse diameter of the chest. You have to make sure that this length is less than 50% of the transverse diameter of the chest. If the ratio is increased, most of the time it is almost due to heart failure. That is, your heart is increased in size, right? Along with this, what next thing you have to see is the bronchiovascular markings. These are your bronchiovascular markings. What are these? These are blood vessels. Why blood vessel appears as white? Because blood vessels contain blood, so that's the reason it's appearing as white. So these are your blood vessels. These are your blood vessels, right? Remember, you have to see these blood vessels, because in pneumothorax, what happens whenever the lung is collapsed, these bronchiovascular margins will be absent, right? After this thing, you have to see is the gas here. Here you can see some amount of gas, but many people will have gas in here because you're having the stomach. But remember, you are not supposed to have gas here. If you have gas here, it's a problem, right? Along with this, you have to see there's any dot spots in the lungs. If any dot spots, that means you can say that you're having TB, right? Along with this, any circular mass, round circle, like if you see the margins are irregular, that is can say that yes, you can have carcinoma of the lungs. Remember, whenever you're doing and reading a chest x-ray, it's not only just radiology. You always have to have the clinical correlation. That means you have to know the history of the patient. Imagine this patient is having tuberculosis. Just by looking at the x-ray, I can say. But also, if I know that the person is having weight loss, he's having chest pain, he's having sputum production, he's having cough for last more than 2 weeks, right? He's having anorexia, he's undernourished person from low social economic status. Yes, it will give more suggestive that this person might be having tuberculosis. Along with this, he might be throwing blood in the sputum. So this will help me to confirm the diagnosis with the chest x-ray. That is the reason always we should have the history of the patient, right? So this is what basically about the understanding of the chest x-ray. Now let us try to see what is the gas on the diaphragm. Directly don't jump into it. Again, this is the trachea, this is the clavicle, this is your lungs, this is your lungs, this is your heart, right? This is the gas here. We are not concerned about other things here. What we are concerned here today is this part. This is the gas on the diaphragm. You see this? This is gas on the diaphragm. Again, this is such a clean margin. This is your diaphragm, and this is the gas. Focus on this part again. Perfect here. Look at this. This is your gas under diaphragm. This will occur if you have any perforation in the intestine. This is a surgical emergency. This very commonly occurs if you are having ulcer. What kind of ulcer? Duodenal ulcer. Because perforation is more common in duodenal ulcer. So you will have gas under diaphragm. Why will you have gas under diaphragm? Because there is gas in the intestine. That is the reason you fart. That is the reason you pass flatulence, right? So this will happen. So problem about this is that it can cause peritonitis, because the food that is present in your intestine is containing bacteria, and that if comes and spills out, it can cause peritonitis. You will be having fever, you will be having, if you press the abdomen, it will be very, very hard. There will be muscle guarding, muscle rigidity. The patient will not allow you to press the stomach, and the overall muscle will come and become very tight. There will be fever, there will be tenderness. If you see the CBC will be dearranged, that means all the inflammation things will come into action, right? That is how you know that the person is gone to peritonitis. So what again, remember, this is the problem here, gas under diaphragm. If there was gas here, no problem, this is normal. But this is the problem here, gas under diaphragm, right? So most of the reason gas under diaphragm is due to perforation, right? That's all for now. And yeah, thank you.